Hello viewers, welcome to Sri Data Plus. Today we are going to see about another update regarding the AstraZeneca vaccines. Denmark stops rollout completely the AstraZeneca vaccines. Okay, before that, if you are not subscribed to my channel, please subscribe and share with your friends. And if you have any comments, please let me know in the comments. Okay, don't skip the video until the end. If you don't like or if you are not interested, please go and watch my another video. It's very important update regarding the vaccine COVID-19 vaccines. Normally everybody have heard about this. The AstraZeneca vaccines, Denmark stops rollout completely. Denmark has ceased giving the Oxford AstraZeneca COVID vaccines amid concerns about rare cases of blood clots, the first European country to do so fully. The move is expected to delay the country's vaccination program by several weeks. Drug watchdog, the European Medicines Agency, last week announced a possible link with clots but said the risk of dying of COVID 19 was much greater. Several European countries had previously briefly suspended the jab. Okay, most have now resumed vaccination with AstraZeneca, but often with limits to all the age groups. On Tuesday, the US, Canada, and European Union paused the Johnson and Johnson vaccines for similar reason over clotting. So regarding the Johnson and Johnson vaccine video I uploaded earlier, we are not watching it. Please, I given the I button. You can click and watch it. Okay, regarding the Johnson and Johnson's issues. South Africa has also paused its use, despite Johnson & Johnson being its preferred vaccine because of its effectiveness against the South African variant. For both AstraZeneca and Johnson, the blood clot side effects are extremely rare, so no need to panic that. Okay, the European vaccines rollout has been criticized by the World Health Organization for being too slow, and there are concerns this latest delay could throw it into the further turmoil. Both vaccines work by a similar method known as adenoviral vectors. Okay, so next we are going to see the points about why is Denmark stopping the AstraZeneca vaccines. Danish officials said that all 2.4 million doses of the AstraZeneca vaccine would be withdrawn until further notice. The Danish Health Authority said studies had shown a higher than expected frequency of blood clots following doses, affecting about 1 in 40,000 people. It comes after two cases of thrombosis in Denmark were linked to the vaccinations, AFB reported. One of the cases in a 60-year-old woman was fatal. Director General Soren Brostrom said it had been a difficult decision, but Denmark's had other vaccines available and the epidemic there was currently under control. The upcoming target groups for vaccinations are less likely to become severely ill from COVID-19, he said. We must weigh this against the fact that we now have a known risk of severe adverse effects from vaccination with AstraZeneca, even if the risk in absolute terms is slight. Okay. However, the authority said it could not rule out using it against at another time. During the press conference of the head of the Denmark's medicine agency, Tensha Erusens fainted and was taken to hospital as precautions. The agency later tweeted that she had recovered. Okay. Next, we are going to see and going to understand about how do adenovirus vaccines work. Okay, the process is adenovirus. We introduced the adenovirus in the COVID-19 vaccines. Adenovirus normally commonly causes respiratory tract infections in the chimpanzee. I think you have already heard about this. So adenoviruses are found in humans and other animals. Okay, scientists use a modified version of one of these adenoviruses, known as a vector, to deliver important instructions to cells. According to the US Centers for Disease Control, CDC, okay, they work by entering the adenovirus, how it's working. They work by entering cells and using the cell's machinery to produce a harmless piece of the virus that causes COVID-19, known as a spike protein. The spike protein is the dangerous ones of the coronavirus. The coronavirus is used by means of using spike protein. It tried to enter our lungs. Okay, the cell then recognizes that the spike proteins does not belong there, and this triggers the immune system to fight back against what it thinks is an infection. Okay, this process allows our bodies to learn how to protect us against COVID-19. So we teach our body immune systems how to protect us against COVID-19. Okay, regulators are now investigating whether an unusual immune response to the adenovirus vaccine is causing the rare but severe incidence of blood clotting has occurred as a problem for the Johnson & Johnson vaccines and AstraZeneca. But it's very rare. No need to panic. An official from the US Food and Drug Administration told Reuters it was plainly obvious that the cases of blood clots linked to the Johnson & Johnson vaccines were very similar to those linked to the AstraZeneca vaccine. The US paused rollout of the Johnson & Johnson vaccines after 6 women under 50 developed rare blood clots after getting the shot. The UK, 30 people had developed unusual blood clots, and 7 of them had died after getting the Oxford AstraZeneca vaccine, out of a total of 18 million vaccinated. Very small amount. Okay, what are other countries doing? We are going to see about what are other countries doing. Some European countries have limited the use of adenovirus vaccines to all the people. Okay, they limited uses of adenovirus vaccine to all the people who have been less affected by the rare blood clotting condition. After the Danish announcement, France said it viewed the AstraZeneca vaccine as an essential tool. It is important to that these vaccines continue to be deployed. It is a vaccine that is safe and works, a French government spokesman said. Okay. The France will also go ahead with the plans to give the Johnson & Johnson vaccine to those aged over 55. The spokesman said the country has already received 2 lakhs doses. Okay. Belgium will also give the doses it has received, while Greece and Italy will not. Okay, that is the end of the video, the health updates. So we'll see in another new updates about health updates. Okay, if you like, or if you want to listen my news, please subscribe my channel and share with your friends. Okay, see you. Thank you for watching so far.